Right. Thank you very much for having me. It's a privilege to be here today speaking before the Commission. I am an assistant professor in the Department of Epidemiology at University of Florida, a licensed clinical psychologist, and I have been researching health effects of fluoride exposure for over 10 years now. So for today's, I'm going to present the research on this topic on fluoride exposure health and neurodevelopment. I don't have any conflicts of interest or disclosures related to the material in this presentation. So for today, I'm going to talk about what fluoride and fluoridation additives are, impacts of fluoride on health, including effects on the bones and pineal gland, which is a gland that's important for our sleep regulation, as well as the current state of the science on fluoride and neurodevelopment. And the current state of the science shows that chronic fluoride exposure in early life is associated with worse child neurodevelopment, even at US levels, so levels we commonly encounter in the United States. Fluoride is a mineral that naturally occurs in rock and soil, and it can leach into the drinking water from these things and then naturally occur that way. Community water fluoridation in the United States began in 1945 for preventing dental cavities. And the data from the CDC from 2022 shows that approximately 72% of the US population on community water systems was receiving fluoridated water at that time, although that prevalence is changing every day. The recommended concentration for fluoride in community drinking water is 0.7 milligrams per liter. It was previously a range of 0.7 to 1.2 milligrams per liter, but it was lowered in 2015 because so many children and adolescents had something called dental fluorosis. So dental fluorosis is an outward manifestation of excess fluoride exposure, meaning that when there's too much fluoride in the body during tooth development, it impacts how the teeth develop. And it can range from mild, with manifesting as white spots on the teeth, to more severe cases with this deep brown staining and pitting of the enamel. And the most recently released data from the National Health and Nutrition Examination Survey showed that approximately 70% of children and adolescents in the United States had some form of dental fluorosis. So that's 70. And it's mostly mild cases, but it's there. So what is added to community drinking water is quite different than the naturally occurring fluoride in the environment. The NSF approves 3 chemicals for community fluoridation. These include fluorosilicic acid, sodium fluorosilicate, and sodium fluoride. And these are byproducts of phosphate fertilizer production. So research shows that fluoridation chemicals can be contaminated with other things, including metals, for example. So a study found that hydrofluorosilicic acid also contained arsenic, lead, and aluminum, and that sodium fluoride also contained barium and aluminum. Other research has shown that when fluoridation chemicals are combined with disinfecting agents like chlorine or chloramine, that they can cause lead from lead-bearing plumbing to leach into the community drinking water. So I would liken fluoridation chemicals more so to chemical mixtures that also contain fluoride. So of course, fluoride is beneficial for cavity prevention, especially when we apply it to our teeth. But when ingested, fluoride accumulates in our bones, teeth, and other calcium-containing organs and glands, including the pineal gland and the developing brain. Fluoride has quite complex effects on bone, so it's been shown to increase bone mineral density of certain types of bones, but also contribute to changes in bone quality that contribute to bone weakness and an increased risk of fracture. And we see this increased risk of fracture even at levels that we commonly encounter in the United States. As I said, fluoride accumulates highly in the pineal gland, which is a small gland located at the base of the brain. It produces melatonin, which is a hormone that regulates our sleep. And fluoride concentrations in the pineal gland are associated with something called pineal gland calcification, which is essentially a hardening of the pineal gland that's associated with sleep disturbances and neurological problems, including Alzheimer's disease, schizophrenia, pediatric primary brain tumor, and multiple sclerosis. So as I mentioned, fluoride can impact the developing brain, and there has been evidence of developmental neurotoxicity of fluoride in animal studies dating back 30 years. This study was published by Malin and colleagues in 1995, and it found that rats that were exposed to sodium fluoride in early development developed symptoms of ADHD. And this is the study that actually inspired my career early on in my graduate studies, not only because of the findings, but because Dr. Malin had been fired shortly after publishing them for going against the status quo at the time, and reportedly because it could have compromised the institutional funding for where she was at. And so after she was fired, nobody had really looked into this question for many, many years. And I decided to publish the first human study on this topic in 2015, and we examined prevalence of community fluoridation in relation to prevalence of ADHD in the United States. We found that parents reported higher rates of medically diagnosed ADHD in their children in states in which a greater proportion of people receive fluoridated water from public water supplies. So at this time, there were also studies in other countries that found that high concentrations of fluoride in drinking water were associated with lower child IQ, but we've only had the studies examining low exposures in relation to child IQ really in the last 8 years or so. And so these two studies were conducted in Mexico and Canada and found that they examined associations of prenatal fluoride exposure with child IQ. And they found that approximately each 1 milligram per liter increase in maternal urinary fluoride across pregnancy is associated with about a 4 to 5 point IQ reduction in the children. So the findings between both studies were pretty consistent. And there was a subsequent study published in Mexico City as well that found that higher prenatal fluoride exposure was associated with more symptoms of ADHD in the children, particularly in terms of difficulties with paying attention. And so one of the questions that arose following the publication of those two studies was whether those findings might be applicable to the United States, given that they were published in Canada and Mexico, and whether the fluoride exposures were comparable. And so I led a study that was published in 2023 that examined the fluoride concentration in the urine of pregnant women in Los Angeles, California. We found that the fluoride concentrations in their urine were very similar to those in the urine of the pregnant women in Mexico and Canada in the studies that I just described. Here are other studies published in North America that also found that higher prenatal fluoride exposure is associated with worse child neurodevelopment. I'm not going to go through each one, but we do have copies of them here if anyone would like to read them. One thing that's important to keep in mind is that across all of these studies, they used different methods to assess fluoride exposure. So some included assessment of fluoride in urine, some looked at fluoride in drinking water, and some looked at fluoride in food. And regardless of how fluoride was assessed, the findings are consistent across all of these studies in that higher prenatal fluoride exposure is associated with worse child neurodevelopment. Now, what about infant exposures? So this study looked at fluoride exposure from infant formula and child IQ in a Canadian birth cohort. It found that an increase of 0.5 milligrams per liter in water fluoride concentration in infancy, and with 0.5 being roughly the difference between a fluoridated and non-fluoridated community. And they found that that was associated with approximately a 9-point decrease in IQ among the formula-fed children and a 6-point decrease in IQ among the breastfed children. So a 9-point decrease in IQ, that's like a whole IQ category. That could really shift someone from being, in the average range to below average, or to above average to average. So it's a pretty sizable decrease. As Dr. Latipo mentioned, the National Toxicology Program published their comprehensive systematic review on early life fluoride exposure in child neurodevelopment last August. It included all studies published by 2023. They identified 72 studies in total on fluoride and IQ. And of those 72, 64 found that higher fluoride was associated with lower child IQ. And when they restricted it to only the studies that they deemed high quality, they identified 19, and 18 of those found that higher fluoride was associated with lower child IQ. The report concluded that there is moderate confidence in the body of evidence that estimated fluoride exposure is inversely associated with IQ in children, and that this conclusion is relevant at a minimum to those living in areas where fluoride in drinking water is known to be at or above 1.5 milligrams per liter. They said that associations between drinking water fluoride levels below 1.5 and children's IQ remain unclear, so they weren't sure if levels below 1.5 could be contributing to brain damage in children. Maybe they are, maybe they're not. They didn't feel confident making a determination. But they said that it's plausible that pregnant women and children living in optimally fluoridated communities could have a total fluoride intake at or above the level of those living in a community with a water fluoride level of 1.5 milligrams per liter or higher, because there's individual differences in terms of how much water we drink, how much of the foods and beverages that are made with the tap water we consume, and tap water is not our only source of fluoride exposure. Interestingly, the NTP published an associated study, and it was a rigorous meta-analysis where they conducted a thorough, scientific mathematical investigation into the associations in the studies included in their report. And when they looked at urinary fluoride concentrations below 1.5 milligrams per liter, they found that those are consistently associated with lower child IQ. And so urinary fluoride is going to better capture our total fluoride intake. And this was when considering all studies or only the high-quality ones. They also determined that a dose-response relationship between higher fluoride exposure and lower child IQ exists. So the more fluoride there is, the lower the child IQ is. The NTP report highlighted a need for more US-based studies on fluoride and neurodevelopment. I led the first one that was published last May, and we found that higher prenatal fluoride exposure is associated with more neurobehavioral problems among 3-year-old children in Los Angeles, California. So neurobehavioral problems including anxiety, temper tantrums, symptoms of autism, and headaches and stomach aches of no known medical origin. In particular, we found that pregnant women whose urinary fluoride levels were approximately 1.2 milligrams per liter, which again is less than 1.5, that they had children with nearly double the odds of exhibiting clinically relevant neurobehavioral problems by age 3 when compared with pregnant women whose urinary fluoride levels were approximately 0.5 milligrams per liter. So there are several mechanisms by which fluoride can exert a developmental neurotoxicity. It can readily cross the placenta and accumulate in brain regions implicated in learning, memory, mood, attention, and executive function. And we see these effects in animal studies at both high and low concentrations, as well as in human studies. Fluoride has been shown to alter cholinergic activity, which is a neurotransmitter that's important for our attention, our learning, and memory. It's also been shown to alter glutamate metabolism, which is a factor in anxiety disorders, and it can contribute to mitochondrial dysfunction as well as increase oxidative stress in our cells, which can both contribute to cellular damage and cellular death. And so these studies in humans that I presented are epidemiological studies where we're looking at associations between fluoride exposure and neurodevelopment. But there are several criteria that epidemiologists refer to when we're trying to determine if an association is causal, so whether fluoride exposure might be causing harm to the developing brain. And in the case of the literature on fluoride and neurodevelopment, most of these criteria are satisfied. We see strong magnitudes of association. There's consistency across studies. The exposures are measured before the outcome. So the exposure to fluoride is measured in prenatal development or infancy, and the outcome is assessed in childhood. As I said, there's clear biological plausibility. A dose-response relationship has been established, and there's coherence across the whole literature. We have experimental evidence in animal studies, but it would not be ethical to conduct a randomized control trial in humans where we assign pregnant women to different levels of fluoride. given what we now know about its impacts on the developing brain. So as Dr. Latipo mentioned, there's been a ruling in the federal fluoride trial. And
Thank you, Dr. Malin.
can I keep going? I've got two minutes.
2 minutes? All right. Let's give her 2 more minutes.
Okay, I appreciate that. The conclusion, the ruling determined the court finds that fluoridation of water at 0.7 milligrams per liter, the level presently considered optimal in the United States, poses an unreasonable risk of reduced IQ in children, and that the scientific literature in the record provides a high level of certainty that a hazard is present and fluoride is associated with reduced IQ. So the ruling implies that there is not enough of a margin of safety between the hazard level and exposure level of fluoride in drinking water for dental cavity prevention. The EPA's default is for there to be at least a factor of 10 between the hazard level and exposure level of a chemical. And according to the EPA's default standard, the fluoride concentration in drinking water would need to be 0.15 milligrams per liter or lower to provide enough of a margin of safety to protect child IQ. Although if the hazard to child IQ exists at levels below 1.5 milligrams per liter, as we've seen in several of the studies I've presented today, then there would be no margin that would be safe for the developing brain. There would be no safe level of fluoride in community drinking water for the developing brain. Thank you very much.
Thank you so much, Dr. Malin. And Dr. Stagg, you have the floor, doctor.